Good day, friends of Buzzy. Today we are going to wade into the crazy big morass that is ivermectin. Pro, con, or oh, those idiotic people taking farm animal medicines. All right, so in the past week or two, people have become very aware of the medicine that we've been talking about on this show for quite some time, ivermectin. And I'm going to talk about 3 different things that you need to keep in mind as you hear new data and new political footballs in the COVID vaccination tug of war that is our political and tribal landscape right now. So here is the background of ivermectin. Just briefly, you can look at some of our previous ones, but the concept is that ivermectin is an antiparasitic that we have prescribed in the emergency room for a long time for kids because they get worms, they get pinworms, they get out of their tush. And when that happens, you give them a dose of ivermectin and then you give them a dose a week later and the worms die and go out. I've heard it's very interesting. I haven't seen that part. But the point is that ivermectin for humans is well established. It's been used for a long time. And we also use it as under the brand name Splice, which is made by GSK, which is a one-time dose that gets rid of lice. And that was a big enough deal to be in Lancet, because if you cannot have to comb those little buggers and just take one dose of ivermectin. So we've used ivermectin safely for a long time. How did it get pulled into the culture wars of COVID, and is there anything really to it? So I'm going to tell you 2 things. One is going to be super sciencey, and the other is a story about Bald's Leech Book, an 11th century guide to, if you're a male, being an apothecary, and if you're a female, witchcraft. I was actually in Croatia recently, and they have the world's oldest apothecary, which was done by monks in Dubrovnik since the 300s. And I was like, you know, if you were female and you had all these little pots of tinctures, you would be totally strung up by the neck. So good to be a guy if you're going to be messing around with apothecary stuff in 300, 400 AD. I digress. All right. So before we get to Bald's Leech Book and apothecaries, let's talk about what we need to know about why ivermectin is different from hydroxychloroquine and why I don't think it's worthy of the insane fun people are making of it. I think that this is really something that lets you know that you don't understand enough about medicine and you're biases if you're jumping about all these people being so incredibly stupid to take ivermectin. Okay, so here's the part we've talked about. There is a spike protein that the SARS-CoV-2 virus goes onto, then it goes into the cell, and then it replicates. And so there are a couple different ways to try to deal with this entry. One is to do something that will change the shape of the place where the virus goes in, or something that will block the ACE2 receptor so it can't go in. So there's these mechanical kinds of things. Nasal irrigation is a mechanical way to brush away, because unless you get this ball socket thing going on, you're not going to have it go into the cell. Now, there's an article in Nature that has got beautiful graphics. We'll put the link in. It's pretty recent, but it talks about how the virus goes into the cell. So normally when viruses glom onto receptors, there's something called an endosome, which kind of cuddles around the virus and sucks it in. And hydroxychloroquine changes the pH of endosomes. So that's why people we're thinking that, okay, hydroxychloroquine changes the pH, so that'll be something that should work. Here's the deal. The reason hydroxychloroquine didn't work is because SARS-CoV-2 don't use endosomes. What SARS-CoV-2 does is it does something called a TMPRSS2, which is a different thing, and so it sort of sucks it into the cell. So instead of the cell coming up and engulfing it, the SARS-CoV-2 gets sort of slooshed in with this TMPRSS2. All right, it's a lot of inside baseball, but the point is that the mechanism that hydroxychloroquine used is why it didn't work. Ivermectin has been used for a long time by a really brilliant ICU guy in Eastern Virginia Medical School. He put together way back when I was finding ivermectin, he was finding ivermectin. He was one of the first people to talk about steroids late in the course, but not early, even before the London study came out. So really smart guy, mechanistically inclined, looking at the pharmacology of it, and put together this whole cocktail of things. So the cocktail is kind of important. The way that ivermectin works is several-fold. It's kind of like melatonin. There's a lot of different things it's doing. One thing it's doing is it is an anti-inflammatory. So one possible way that it would help is to decrease the inflammatory cascade. We now know that some of the ways that the virus gets in hide itself for a long time from your immune system. So it's sitting there replicating and building up more and more and more armies before your immune system finds out. This is one reason I would not do intranasal steroids, because you need your immune system active, and steroids of any sort blank down the immune system. Once that cascade builds up, if it starts to overwhelm you, that's when you use steroids. But back to ivermectin. So the other thing ivermectin does is, coupled with zinc, it is an effective intracellular antiviral. So the coupled with zinc part is important. If you look at the NIH website about COVID treatments, it's got fantastic, easy to read synopses of the different studies that have looked at what kinds of medicines work for COVID. And it's got a really good description of ivermectin trials. The problem with the ivermectin trials is that the way that we do medicine in the West is we do a multiple choice answer. It's this or that. It's one thing at a time or something else. So looking at ivermectin in isolation really didn't do a lot. People didn't get worse like they did with hydroxychloroquine because of side effects, and you're not getting very much. But nobody really got better either. The one study where there was a big difference in outcomes, moderate to severe hospitalized, was done in Iran. I think it's still in preprint stage, but it had a pretty good end. It was done in combination with vitamin C, zinc, and steroids for hospitalized patients. So this combination thing actually, I think, makes a big difference. And we're ignoring that when we look at medicine the way we've always been told to, because we look at one problem, one drug as an answer, when we're learning more and more that nutrition matters, that pH can matter, that what's intracellular matters. And this is what brings me to Bald's leech book. All right, I adore this story. So about 2 years ago, someone published an antimicrobial study looking at foot ulcers. And foot ulcers and staphylococcal ulcers are nasty, and they're really hard because you don't have a lot of blood flow down there. They're hard to take care of, just disgusting. And antibiotics aren't that great at them. So I don't know how this person got funded, but they went to a 11th century, 13th century, a book of concoctions called Bald's Leech Book. And there was a recipe for ulcers. And this is like, classic poultice stuff. This is Renaissance, put it on, knights who say knee, just really old timey. And so it had 4 things in it. It had onions or leeks. They weren't sure, so they tried it with both because they weren't sure about the Old English. So onions, wine, garlic, and cow's bile, like you do. And so they mixed them together and they tried them on ulcers. I'm also not sure how they managed to push that one through the IRB. The point is, it worked much better than antibiotics, unless you removed any one of the ingredients. And any one of the ingredients taken out of the recipe, it no longer worked. I think that this may be something of what's going on with ivermectin. I think that perhaps the bringing it intracellular when you have zinc, that's something that matters. Perhaps the antioxidant effects of vitamin C are necessary, but thus far, the results that Dr. Marek in Eastern Virginia Medical School are getting are much better than ICU results other places. The one study that has a bunch of different things in it with ivermectin and zinc and vitamin C and steroids, that was one where it did show some promise. So I'm very willing to admit that ivermectin in an isolation does not work. The data is not there. It's been looked at a lot. Ivermectin by itself does not work. Using animal ivermectin totally doesn't work. But if you're using ivermectin in combination with other things, I don't think we know enough yet. I think we do know that the mechanism is better than hydroxychloroquine was, and I think that the jury is still out. The take home from all of this is that this has been a really interesting time period to figure out how to communicate science to people who don't know science. I've been trying to do it every week on Facebook Lives to greater and lesser successes, but we don't have a good mechanism in our society yet to give people works in progress. The NIH has done such a magnificent job of breaking down research, but you have to be able to read research a little bit to be able to get that information. At least it's all in one place. Because there's not an understanding of both the iterative nature of science, but also the fact that one study alone never proves anything, we don't have an easy way for the public to be informed about this. People were asking me about ivermectin on Facebook, and I answered with the Bald's Leech book story and with the best metaphor I had to say, yes, taking cow's medicine is stupid. However, this is not as stupid as other things are, and there's still a possibility that ivermectin might be part of what works in the future. And I do think it's very safe to say that we don't know yet, that we do know it's not dangerous in human form. We do know we give it to children. We do know there's a rationale for it, but unlike hydroxychloroquine, where we really know it doesn't work, I think that what we know right now is that ivermectin does not work in isolation. When it's mixed with zinc, vitamin C, too soon to tell. All right, I'm going to mop up a couple things in previous Facebook Lives that I've either done really wrong or really right. I said that I don't think that children less than 10 need to mask at all, unless they have pre-existing conditions. I am backing off of that one. There is a new study that very definitively finds that masks decrease the risk of spread. And even though most children are still not going to get very sick because of everything we've talked about in the past, nasal size, it still is something that we don't know the long-term outcomes. So I'm backing off on saying, don't worry about masks in kids under 10. Kids over 10 for sure, kids who are obese, absolutely. But while we have variants around and while we have infections that are over 100 out of 100,000 people, in schools, I think that there's no reason not to mask for a year. I also read a paper that showed that the concern that I'd had, which was development and interpersonal interactions, doesn't matter. The kids who are over 6 are really good at ignoring the mask and getting the cues they need anyway. So no real downside to wearing the mask 6 and up. And you know, it may be fine younger, they just didn't study younger. And I think I was wrong. I think that masking in younger age kids has better evidence than not masking. All right, so that's where I was wrong. Where I'm right, and next, probably 2 weeks from now, we will talk about this in depth, is that, oh my goodness, nasal irrigation is a big deal. We finished our study. The medRxiv preprint is up. The study is now submitted, so peer review has started. You cannot take this as gospel until peer review has been done, but we found that there was an 8 times reduction in hospitalization for people using nasal irrigation. Now, before you go crazy on this was before there were vaccines, but these people still felt sick, and one of them did still go to the hospital. But the national rate in that same age group at that same time was conservatively 9.14%, and not conservatively, but more looking at all the reported hospitalizations only, not the ones that were missing, could have been as high as 21%. In average, the average population in our study was obese. They were a BMI of 30.3. So they're older, average age was 64, and doing nasal irrigation kept them out of the hospital. Dude, I mean, right now the FDA only says that monoclonal antibodies have a 3-fold reduction in hospitalization. So I think that the chances for this to be a real help when we have new variants that are vaccine resistant is strong. Just as we were talking about the SARS-CoV-2 fitting into the ACE2 receptor and getting sucked in by TMPRSS2, this whole mechanical thing is the reason why Delta variant is such a big deal, because if the Delta variant changes the way the antibodies block this SARS-CoV-2 from getting in, then the antibodies no longer work and the vaccines aren't as effective. So irrigation is something that can flush away the virus before it gets lodged in, before you get too many of them. Now, one study found that after nasal irrigation, the viral load level went up again by about 4 hours. So we've only been doing it twice a day, still saw some effect, but there's more to be learned here. The important thing is there definitely was a highly statistically significant improvement with nasal irrigation, and it is something for somebody who's got health issues when, you know, everybody needs to get vaccinated. But if the variants start escaping, then it's an option to reduce the severity. So that's pretty great. As always, if you've got any questions, please send them to me so that I can address them. Next time, I'll go into more detail about the nasal irrigation paper, the statistics, and I'm also next time going to talk about how you do nasal irrigation on vacation, what my techniques are, what I recommend, what you take with you when you use it, how you pull it off, all of the good stuff. So until next time, please, if you don't know the science yourself and you're not personally able to do peer review, just have a little bit of grace and a little bit of reserved criticism for mechanisms that may or may not be fully proved or disproved. And everybody in healthcare is doing the best they can. We're all trying really hard to understand this and explain it the best we can. And one final plug, if you have not gotten vaccinated, Buzzy decreases pain, decreases fear, and one study found it decreased fainting. So if you haven't gotten vaccinated, if you know someone who's afraid of needles, please get them a Buzzy, loan them yours, but by all that's holy, go get vaccinated. All right, it's going to be fine. Bye, y'all.